Hey everybody, Dr. Tom at the Active Healing Center. It is Mobility Monday. We're going to work through our SI joint area into our lower spine. We're going to start to work on some good ways to build mobility into that area. One thing about the SI joint, when I talk to people about this, when they first come into the office and they say, a lot of times people confuse the hip for the SI area. They'll say they have hip problems. When I ask to point to the area that they're having problems with, they point back into this region, back in here, into the butt area, and that's really your SI joint, your sacroiliac joint. The hip is out over here, your SI joint is back in here. Certainly telling us that the pelvis, there's definitely an imbalance in the pelvic, lower spine area. That needs to get worked on. It is, just look at it. Your SI joint, it's the bottom of the chain. It's all the stress is getting pushed straight down onto these pelvic and SI joints, that pelvic region. We need to pay some attention to that. If we don't do enough work and mobility work, eventually it's going to start to rear its head and cause problems. So let's jump into it. First of all, our release tool. So we're going to work on our progression of 3 movements here. So we're going to release the muscles, we're going to stretch the area out, and then we're going to mobilize the area again to reset the nervous system, start driving that motion in there, creating better mobility, get those imbalances out. The more imbalances, the more problems we have. So our preferred release tool is going to be the foam roller. So again, we've done videos on foam rolling the spine in the past, but the areas that we're going to hit, we're going to work the foam rolling the spine. We can work the entire spine, but obviously we're going to work through the lower portion of the spine. All right, we're going to work into the glute muscles so we can get right up on here and work into those glute areas. Just kind of rotate over to the side a little bit and really drive into the glute. We can get into that SI area. Should feel good. It may feel a little uncomfortable, obviously, a little sore, but that's okay. That's what we're going to work out. Certainly want to make sure you hit both sides, work through those areas real well. But we also flip over and get into the hip flexors and work those areas, because all of these muscles, all right, your hip flexor muscles, your hamstrings, your glutes, lower spine, they're all tying into your pelvis, responsible for creating motion in there, stabilizing the areas, supporting that area. So we want to make sure we hit all of those spots. So again, foam roll, lower spine. If you want that video, how I show you how we teach foam rolling the spine, send us a message and we'll get that out to you. But foam rolling the spine, foam roll the hip flexors, you can foam roll your glute muscles, your hamstrings, so you can hit all those areas. Again, set your timer on the phone, give it a minute, couple minutes to work those areas out. Great way to release into that area, to stretch. I like working with our stretch strap into this one. So we're gonna get onto your back. We can stretch out the hamstrings. So you set your stretch strap and we're gonna work through the hamstrings, okay? Get that leg nice and straight. What we want with these types of stretches, my down leg stays toe pointing straight up in the air. We don't want those legs rotating out at all. So we're gonna keep the toes pointing straight up in the air, keep the leg nice and straight. I'm just gonna stretch. Again, set your timer, 30, 40 seconds. If you're real tight and restricted in these areas, you're gonna do it a couple times. So this is gonna hit our hamstrings. Then we're gonna drop that out to hit the inner quad muscles into your groin area. Again, 30, 40 seconds. And then we're gonna come over, and this is gonna hit more into the SI joint, your glute muscles. I can feel it's all through here, stretches that really well, okay? So we hit all 3 of those stretches, 30, 40 seconds. Again, if it's real tight, real restricted, we're gonna do it a couple times. It's a great movement to really work into that area, to mobilize. So that's our stretching. Our third component here is our mobility movement. So couple ways we can start to mobilize. First, before I say it, you can see the funny looking chair that we have. The wobble chair would be the gold standard for driving motion through your lower spine. Great for your SI joints, your whole pelvic lower spine area. So the wobble chair is the gold standard. We can use a portable wobble cushion to do the same at home, or go on and get a Dynadisc, disc, a dyna disc. That's a great rehab tool. You can work all these motions. What we teach here is like figure eight patterns on there. We've done wobble chair. We've done videos on wobble chairs again. So if you have any questions about that or you want that video, shoot us a message. We'll get that to you. But that would be the gold standard for really driving motion into that lower spine, building that mobility. Without that, we can get into laying on your back. Everything's down. So that's the key component here. Our shoulders are down on the floor. And what we're doing here is just a rotation. And we're going to rotate to the side. And we're going to hold this for a breath or two. So a couple of deep breaths. And then we're going to rotate over to the other side. And again, shoulders stay square and flat to the ground. And get this moving through here. Again, I can feel some stiffness and restriction into these areas right in through here. Goal is that we can get both of these knees pretty much flat to the floor, flat, no space between the knees, and really be able to hold that and drive that. So you can get a look at that. You want the knees to stay together, get to flat to the ground, head down, shoulders down. Again, feel it all through here. It's a great movement, about 20 times to each side. So not 20 total, 20 times to each side. So if you're gonna count it, depending on how you count it, 40 total, 20 to each side. Another movement we can do here would be more of a pelvic rock position. So we're flat to the ground. We're gonna rock our hips back like you're trying to pull your belly button to the ground, and then you're just gonna reverse it and try to arch your spine and your belly button up towards the ceiling. And you're just rocking back and forth. Another really good, easy motion to drive movement into your lower spine, into your SI joints, your pelvic area. Again, 20, 25 times you're gonna work that. So just do it with your breathing. Nice deep breaths, nice fluid motion. Should not be painful. You may feel some soreness and stiffness. That's okay, because that's what we wanna work through and drive some motion in there, but we don't want sharp stabbing pains, shooting pains, radiating pains, any of that. That's the red flag. Means you need help. You're gonna give us a call and come on in and get it checked out. But this is how we start to really work that lower spine, your SI joints, driving motion in there. Again, release it, foam rollers. Hit all those areas throughout your lower spine, your legs, hip flexors, quads, glutes, hamstrings. We're gonna stretch. Good way to do it is with the stretch strap. Stretch out those hamstrings, stretch out the lateral portion into the SI area, glute area, stretch out the inner quads. I did not mention it, but you could also stretch out through your hip flexors. The way we do that is we get into our position here, and we're just gonna drive motion. This is stretching out through my hip flexors. So you can hit all those good movements, stretching 30 to 40 seconds, and then we drive motion. If you have and can take advantage of a wobble cushion, in the office, we have obviously a wobble chair. Grab a dyna disc, go online and find a dyna disc. They're fairly inexpensive. Otherwise, we're gonna drive motion with our hip rotations, drive it down into your SI joint, really good movement. So you can do the pelvic rock. Really good way to start mobilizing, building mobility. If you're having lower spine, SI joint problems, this should be done on a daily basis. Otherwise, just for routine maintenance, you're just gonna do this a couple times a week and really work through that. Any questions, give us a call. We're here to help. Let's get moving. Take care.